Unmuted. Hello, check, check. Hello, check, check, check.
Good, you sound good out here.
What? Hello, check. Hello, check.
Sounds good.
Okay.
Where's Jenna?
Yes,
She's coming. She's trying to get a battery from her car.
Hey, man. Relax, Sam.
We need to, Jenna doesn't have a battery right now.
Yeah, she's trying to get one.
Okay, we'll hold off and give Jenna an opportunity to get here. For those watching by YouTube, I know it's 10 o'clock and we're supposed to start, but one of our media outlets is needed to go get a battery, so we're a little delayed. Bear with us, please.
Do you have an extra battery? Give us a battery. No, mine's.
And here she is. You let me know, Jenna. All right. Well, good morning, and thank you for joining us for our Friday community update. Today, I'm joined by Decatur City Schools Superintendent, Dr. Michael Douglas, and Chief Nursing Officer Nada Walden with Decatur Morgan Hospital. Thank you for joining us this morning. Our guests have important information that impacts all of us. And from distance learning updates for the rest of the 2019-2020 academic year to medical response in our community. So without further delay, I'd like to turn the floor over to Dr. Michael Douglas, who will fill us in on details from yesterday's State Board of Education press conference and how it will impact our students. Thank you.
Thank you, Mayor. I appreciate the city having us in. We'll be pushing out information to our teachers and our parents this afternoon, but I appreciate the opportunity to kind of share with our city. Obviously, that went out at 4. We had a meeting this morning with the state superintendent at 8:30. So to say that the plan is ever evolving would be an understatement. I'm going to take a little liberty because the last 8 days as we've transitioned and been pushing out work and feeding kids, I would be remiss if I didn't thank some people. I want to thank my school board. They've done a good job of being responsive to the parents, and they've also forwarded all the questions to us. I wanted the parents to know that your school board members, every question you ask them, they ask us, and we try to get that information to you. Dwight Satterfield, can't say enough. He's been the boots on the ground, running around, putting his own health at risk. You know, he has been instrumental in making sure that our facilities were got clean, disinfected. He's overseen the maintenance crew. So I can't say enough about what Dwight's done. Dr. Evans, Dr. Underwood, Dr. Davis, Emily Elam have really worked tirelessly on a distance learning, e-learning plan. We call it both because we'll do a hybrid model when we start back school. Melanie Maples, Mandy Jones, from a financial standpoint, you know, they've found ways for us to compensate the CNP workers that have came in and the maintenance crews that have come in. To Jennifer Dickey, that's Dwight's secretary. You know, she's kind of that one that nobody sees as much, but she, I joke, she puts up with Dwight, but also helps him instrumentally. Obviously, Jennifer Springer, my secretary. Dustin Free, the entire maintenance department, along with our custodians, they have cleaned and disinfected buildings. Then we host people for a tornado, and then they come back in the next day and re-sanitize both high schools. Can't thank them enough. CNP workers, Julia Sin, she's over CNP. All of our CNP workers, you know, they volunteered to come in and give their time and put their own health at risk in order to feed our children. We fed anywhere from 1,000 to 600 kids a day, and I just can't say enough about them. Our teachers, some of them haven't missed a beat to the chagrin of our students. They've been pushing out work. And so I appreciate theirs. You don't go into teaching to talk to a computer screen or to do stuff on paper. You want to see kids. So I just appreciate everything that our teachers have done. Our students, this is one of those life events that all of us adults have had different life events you'll never forget. My heart goes out to the seniors, particularly those that were involved in senior athletics, your final band concert, proms. Those things are things that, I don't know, throughout the planning process of what we're looking at going forward, your heart just goes out for those seniors, those things that you can't get back. So to our parents, I know there's a lot of anxiety. We're going to do the best we can to honor our seniors, and we're going to find different creative ways. But I'll touch a little bit more on that. To our parents, we need to breathe. I know there's a lot of anxiety, a lot of questions. We'll answer all your questions. We won't answer them all today. It's going to take time. But Decatur City Schools is going to be fine. Our kids are going to be fine. And we're going to educate them to the best of our ability. And then next year, whatever we've got to remediate, we'll remediate. But we're going to do the best we can. A little bit into when Governor Ivey made her announcement yesterday, essentially she ended face-to-face instruction for the remainder of the year. We've been working on 4 different plans. And so now we're with our final plan, which was what would it look like if we had to provide instruction either through packets and online one-to-one. And that's what we're going to do going forward. Starting April 6th, we'll be ready to go. We'll be observing spring break starting today, going through April 6th. But on April 6th, we'll start back, and basically students in grades 3 through 12, very similar to what we've been doing the last 8 days, they'll be getting assignments digitally. And then our pre-K through students in 2nd grade, they'll be getting kind of take-home packets. And that's kind of the overarching framework for the plan going forward. A lot of the bigger questions I've gotten obviously have involved seniors. We can't do anything until June 5th. That's the date that the state set. I really can't comment on a commencement or a graduation ceremony till after June 5th. I know some school districts have talked about July 31st or June. It would be all of our hope that at some point in time we could provide a graduation ceremony, but it would be irresponsible to do that until the Alabama Department of Public Health gives us the all clear. So we're not closing the door on anything, but I also don't want to give false information and put a date out there. That's been one of the bigger questions that I've gotten. The biggest difference between what we've been doing these 8 days and what we will do going forward, during the closure, State Superintendent said that, hey, the work we're pushing out is optional. When we start back April 6th, we're not working under that optional. So basically, we're going to do the very best we can to cover the standards that we've covered. But also any of them that we haven't covered, we had most of them covered because we were coming up on state testing. And so, but any standards, the state calls them critical standards. Any of the standards that we haven't taught, we will teach, and we'll go from there. Dr. Underwood, I want to mention her. She's done a great job ensuring that we're going to make sure all of our special needs students, that we're going to provide them FAPE. We've got a good plan for that. I just can't go enough and say enough about the team and kind of the framework of the plan. Will we have to make tweaks? Absolutely. Will there be a device that breaks? Sure, we'll fix it. If we don't have anything, if we can't push it out, then we'll get a paper packet out. Is it perfect? No. Is it ideal? Absolutely not. There is no substitute for face-to-face with a good quality teacher. But I can promise you this, I've watched our teachers in this district, they're phenomenal. They're going to provide your kids the best education that we can provide. And you know what? If there's anything that we've got to give you extra help with, we'll have hotlines. We're going to have tons of things to support you. But at some point in time, we're going to go back face to face. And if there's anything that we've missed or we haven't, done right, we're going to make it right. But, this city's going to get past it. This school system's going to get past it. I'm asking everybody, don't do any work next week. It's spring break. I know we pushed out a bunch of work. Our teachers were fired up. We pushed out. People were saying, oh, it's a lot of work. It's a lot of work. Don't do any work next week. Be with your family. Enjoy spring break. On April 6th, we'll start that dialogue. Now, is April 6th, is it going to be working great? No. But by about Tuesday or Wednesday, we'll have it dialed in, and it'll get better every single week. And I know that, there's probably tons of questions, and I'll defer to those. I'll apologize in advance. I probably have more questions than you do, so, but I'll answer all the questions that I can. But thank you for having us.
Sure. Thank you, Dr. Douglas, and to your dedicated staff of educators and administrators for all you do for the Decatur City Schools. We can all see that every team member is dedicated to the success and safety of our students, and we're also grateful for the resources you have generously provided to our community. So we have with us another key community leader who is on the front lines of protecting and healing our community, Decatur Morgan Hospital Chief Nursing Officer Anita Walden. Anita, we're thankful for you taking time out of your incredibly busy schedule to spend a few moments with us, and I think I speak for everyone whenever I say that words could not express how grateful we are for Decatur Morgan Hospital and every action you all are taking to watch over our families and our neighbors. And so please tell us your operations to date and how we as residents can ensure that we are doing all that we can to slow the spread of COVID-19.
Thank you, Mayor.
Thank you.
I am honored to be here to represent our leadership team and all the wonderful medical team that's at our hospital. I'd like to begin by saying that our medical team has been working diligently every single day to ensure that our hospital continues to run smoothly and that we take care of every patient that presents to us for care. As you can guess, COVID-19 has altered our process somewhat. During this time of crisis, we have found that communication is key, and because everything is changing very rapidly. We make a plan, and in 5 minutes, something changes that, and we're just rolling with it. Our team is pulled together, and we've been able to respond to every challenge, every request. We've had new algorithms, new protocols, new processes, and like I said, we are dealing with those very quickly. Some of the changes that we've made, and the city probably already knows this, but we've eliminated visitation. That's been a tough one. That was very hard on us. We appreciate our families, loved ones of our patients. We know how hard this is for them, and so we're trying to work through that with telephones and that kind of thing for all those patients. We've closed all but one entrance. So every day, everyone who walks through the door of the one entrance gets their temperature taken, and you get a little sticker that says, "I'm good." Anybody that has a temperature of 100.4 or above cannot come in, and that includes staff. We are assigning team members to continually wipe down all surfaces, telephones, doorknobs, anything that can be touched. We have taken from our labor pool and just made that assignment for that person. Our administrative incident command room. Normally we're sitting shoulder to shoulder, and we have marked our table off in 6-foot lengths. And we absolutely do not go over those. We are very protective of those spaces. We have a sign that's across the door that just warns people that we are honoring our 6-foot rule. So anybody that comes in, that we have chairs in the corners and you can sit there And when there's no chairs, then you stand 6 feet away from everyone. We constantly remind each other, wash your hands, wash your hands, wash your hands. During the crisis, communication, again, is so key. Every day we have a daily conference. And we have a call with our directors and our managers. We need to hear from them. We update them with whatever today's news is, and we field their questions and comments. We participate in a daily conference call with Huntsville Hospital system leaders every day. And during that call, what we're trying to do is standardize the way we do things across the system. And again, that's moving very quickly. So we are passing ideas, protocols, things that have worked to each other. We also participate in regional and national teleconferences, and that's almost a daily thing as well. Today in our team's morning briefing, what was included is we have 101 inpatients today. We have 91 beds that are open and available to put patients into. We have tested 77 patients up until this point. So far, we have 50 negative results, and we have 5 positives. Of those positives, 2 are inpatients, and 3 are quarantined at home. We began a drive-through fever clinic in Hartselle on Tuesday. Patients must have a physician's order to go to that drive-through clinic. We have tested so far 34 patients for COVID-19, and we've gotten back 17 results, all negative. We had 2 positive flu results. Now, what we're hoping for is that the patients have been tested for flu before the physician sends them to our clinic. But just in case, that we will swab them for flu. One of our challenges has been a nationwide shortage of personal protective equipment, or PPE. We're doing the best that we can to preserve and to conserve our resources. We have infection prevention protocols in place already that protect our team members as well as the patient from becoming infected. At this point, our PPE supply is adequate. But some of our conservation efforts have included, of course, eliminating visitation. That stops anybody who is a visitor from having to dress out and go in the patient's room. That saved a lot. Grouping our care tasks by nursing and other caregivers, including physicians. We've seen so much collaboration going on between all caregivers, whether that's respiratory therapy, the lab, or whomever. We figure out what we need to do for every patient, and we try to group those tasks into one visit into the room instead of several. We've changed the process of having our meal trays delivered by dietary, and that has become a nursing function. Our nurses are doing lab draws when possible. That keeps a lab personnel from having to go in the room and with a possible exposure, and it also keeps us from using up our PPE. Once again, I want to thank our medical team in this community, in our hospital and out, for their support and their dedication. Every day, countless doctors, nurses, technicians, and support services of Decatur Morgan leave their homes and their families to come and take care of those who are in need. This type of dedication was happening well before COVID-19, but we sure appreciate what they're doing. And so many of them have just stepped up to the plate and have volunteered their services and asked if they can help out in any way possible. So we really appreciate that. And again, I want to thank the families and the loved ones of the patients that are in our hospital who cannot visit. We know how hard that has to be. We apologize, but we want to keep everybody safe. I want to thank also our local businesses and groups and individuals that have reached out to us and offered to donate food. I'm just amazed. And again, I'm not amazed. We have got a wonderful town here in Decatur, in our county. People have stepped up, and we appreciate every single thought, every note, certainly every donation of food and other things. We appreciate that. Your kindness means more than you can know. It has lifted the spirits of our team in this stressful time. And finally, on behalf of our team, please, we want everybody to understand that this is a serious crisis. We need everybody in this community to adhere to safety standards established by the CDC and the Alabama Department of Public Health, the ADPH. Please remember to separate, sanitize your hands with soap and water anytime you can, but make sure that you're separating and sanitizing. We can avoid the fatal consequences that we've seen around the globe and even in our country if we will do those things. So thank you very much.
Thank you, Anita, and the Decatur Morgan Hospital staff for all that you're doing as our community healthcare institution to treat and protect our residents. The City of Decatur is grateful for every healthcare professional and the work that they do, especially during this unprecedented time. So thank you. Dr. Douglas, I think you had another comment that you wanted to share.
Well, I just wanted to, I was going down my list. To my principals, I cannot thank you enough for what you've done. They've been having virtual faculty meetings. I think one of them's got cabin fever. He put out a video to students. It looked like Castaway where he's talking to toilet paper. Yeah, but we've got good leadership at these schools. I know from a parent perspective, you'll be working a lot with your principals in terms of communication, but I would be remiss if I didn't mention our principals and just everybody. There's somebody I'm sure I'm missing. To the entire staff, I appreciate it, and I'm sure we'll have plenty of questions.
Thank you. So before we conclude, I want to extend some thank yous. Behind the cameras during all of these press conferences that we've had is our Chief of Police, Nate Allen, who serves as our incident commander. I've been doing my job for about 3.5 years. Chief Allen has been serving as in law enforcement for 30+ years and handling crisis professionally, and this seems to be right in his wheelhouse, one of his strengths. And I value the counsel that he provides, his leadership. And then he is supported by our public information officer, Emmy Long, who continues to do a wonderful job of getting the message out and communicating on behalf of our city. We try to have one message that goes out. We think it's the best for our city and our residents, and we want to try to send out accurate information. So Emmy, thank you for what you're doing. So before we conclude, please remember that garbage collection is fully operational and continuing as normal. Curbside recycling collection is temporarily suspended. Please do not use your recycling bins for garbage collection. If you need another garbage receptacle, please contact our Sanitation, Street and Environmental Department, and they will assist you with that. Police and fire, they're operating as usual. If you have a non-emergency police report filed, remember that you can call 256-341-4600. That's 256-341-4600, and the Decatur Police Department's front desk officer will gladly help you. Now, City Hall is only accessible by appointment, and if you need to contact one of our departments, you can do that by visiting our website and get the department's phone number. Oftentimes, we find that by making that call, we're able to handle your needs right there on the phone, just with the technology that we have today. So it's also important to note that we're following the guidelines as a city that were established by Alabama Governor Kay Ivey and the Alabama Department of Public Health. And overall, our residents, I was talking with Anita before we started the conference about just what a wonderful job our residents are doing. Occasionally we'll see someone not following the 6-foot rule. And I watched a press conference yesterday with Mayor Battle, City of Huntsville, and he has a new sign that he's trying to make universal. So it's, if you see someone that's not practicing that 6-foot rule, it's to do this and then do that, followed by a smile. Be sure to give a smile. You want to do it in a nice way, but remind people to separate. That's what we need to happen. So this week we've covered a lot of ground. We've had our first diagnosed case in Morgan County to small business assistants. This weekend, the number in our community will likely continue to increase. Let us remember that this is not a time of fear, not a time to fear. Now it's crucial that we continue to practice social distancing habits. That's this, to protect all of our community members and to reach out to those who might need help, beginning with a phone call. I challenge you over the next few weeks to support one another, one of our local independent businesses by purchasing an electronic gift card or ordering a pickup or delivery for food for some of our neighbors. When the going gets tough, we join together and remember that together we can win this fight and beat this. And I'll see you again at 10 o'clock on Monday. Now we'll take a few questions.
We're going to start with Michael, if that's okay. You guys are on spring break, for the next week. Although kids are not doing schoolwork, what does this look like for teachers and administration who are planning? This was the unforeseen that you guys, this is a reality now. So what does the next week look like for you guys as administrators?
We're actually pretty fortunate because before we took the break, we were getting ready to push this out. So we had all of our teachers have 5 days ready to go when we come back from spring break. Now, we identified that the packets for pre-K through 2, we didn't. So what we did is we had our pre-K through second grade teachers come in the last 2 days in hour shifts and get those prepared to push out April 6th. So we're kind of fortunate in that, we had 4 different plans, but one of them was to be ready for this. So we actually were ready, and we have all of our teachers are ready to push out 5 days of work. So we feel pretty good about where we're at now. We'll probably still have to button up the details of the bigger plan this week, but in terms of our teachers, I feel really good. We really wanted our teachers to have the opportunity to enjoy spring break. This has been stressful on everybody, but we feel like, and my message to students is, hey, I know your teachers gave you a lot of work. Next week, we just need to take a breath, enjoy spring break.
So a big concern is for parents who have, students that are juniors, who are doing college prep, who can't take their ACT, SAT. How are you guys combating that issue? It is a big concern for parents and students who are trying to go to the next level.
Well, absolutely. We pushed out ACT prep work virtually. Obviously, in terms of sitting down and taking the test, we'll defer to ACT, but all of our advanced placement and dual enrollment students, they've continued. They never stopped. They never checked up. Thankfully, A+ just put out that AP students will be able to take their tests from home. But our teachers, our AP teachers have just been going on as normal, but our dual enrollment students have been going on as well. But in terms of ACT and getting prepared, we'll defer to ACT about whether or not they still honor the testing dates that are scheduled, but we have as a district pushed out ACT prep type material.
You keep talking a lot about packets and teachers preparing this work for kids. I'm guessing some of it is also online. Is that correct, some of the work?
3 through 12 will be online.
Okay.
We pushed out little MiFi boxes so that we've got internet access. But we thought for the younger kids, the focus on reading, early literacy, math, we didn't want to get bogged down with devices in the early grades. So we'll be pushing out paper packets. I will tell you, and everybody that knows Dwight Satterfield, I sent him an email last night. I need a protocol for the sanitation and cleanliness of the packets. one person using the copy machine, one person wearing gloves, so that our parents know when they do pick those packets, we've done everything we can to sanitize, but we would also encourage them to sanitize before they open them up as well.
For the 3 through 12 that are online, what did you guys provide? Tablets, computers? You said MiFi, so internet is covered, but for those kids who don't have those electronics at home, what are they doing?
They have Chromebooks. We're a district. We have issued Chromebooks 4 through 12. Right before we pushed out Chromebooks to third graders. The third graders got kind of the older Chromebook, so we might anticipate a third grader, their device may or may not work, so that's when we would push out paper to them. But we're a 1-to-1, 4 through 12, so our kids are already familiar with working on those devices.
Have made notes like Dr. Douglas, and I realized that I didn't cover everything that I had as far as some thank yous and recognition, but our Information Services Department is allowing us to be able to communicate with the public now through YouTube, and doing that in public meetings, and even doing that now. And we're thankful for their work. They're behind the scenes right now, and for putting together some laptops pretty quick with VPN, so some of our workers, our employees, are able to actually be productive by working at home. We're also very thankful for Fire and Rescue, Decatur Fire and Rescue. They're the professionals that represent that department. Most of our calls are for healthcare related matters, incidents of that nature, falls, things of that nature. But we're very thankful for them. Of course, we're thankful for our directors and their leadership, and our overall our city teammates. Everyone is doing a wonderful job in making sure that we're providing uninterrupted services. So thank you. That's all I had to share.
And we have some questions just on the numbers that you provided for us. You said there's currently 101 inpatients at the moment. There's 91 beds. How will you guys combat, let's say a surge does come in the next 2 weeks, enough room for potential coronavirus cases?
So we have identified other areas that we could put bed stretchers if we need to. And we have a labor pool through our HR department. So those folks out there that want to work can submit their name. We are under an emergency declaration from our ABN board as well as through the state. As far as a surge plan, we have put that into place. There's been a lot of preparation in dealing with what equipment do we need, what supplies, what kind of staffing would we need, and where would we put those folks. So there is a.
I'm sorry.
There is a surge plan in place.
How many ventilators are you guys working with right now?
We normally have 11. And so then we have secured a few more through rentals. So, but we are nowhere near capacity yet. And we also are working with our Huntsville Hospital system. So
there's currently 2 coronavirus patients in your facility.
yes.
How do you guys, what is the process? What does the room look like? I mean, we don't know, in a hospital.
Right.
Should be isolated, but how does that work?
So they look like most any other isolation patient. The only difference in the PPE that we would use is the N95 mask instead of just a regular surgical mask.
Could you talk about the condition of those patients, if they're on ventilators at the time or right now?
I really don't have that information. And also, I have to think about HIPAA. And so, a part of HIPAA is they could be easily identified by whatever information I would give. So we do have a team, of course, that is assigned to know all those statistics, but I stay out of those records.
I've heard other hospitals in Alabama and around the country, their population demographic isn't what we expected. It's not that older population that is going to be heavily impacted by this? I know HIPAA laws apply. However,
Right.
can you explain the demographic that you're seeing in Decatur Morgan Hospital at this time?
So, I don't know if you saw Dr. Scott Harris yesterday from the ADPH, but the average age in Alabama is 49. So it's a little bit younger than what they're seeing nationwide. I do not know what all the patients in Morgan County's ages are. And quite honestly, I don't know what the two in our hospital is today. That is certainly information that we could possibly get to you at a later time.
So there's 3 deaths right now in the state of Alabama, just in our region. So my question for you is, are you worried about more patients getting sick to that point? And maybe how fast does it take for a coronavirus patient to get to that point of death?
That's a great question. Of course, I'm very worried. As we look at, I watch the news every day. I see what's going on in New York and in Louisiana and out on the West Coast. Things can change very rapidly. As you have seen, our numbers have changed overnight. So, again, that is something we talk about in our leadership group every single day. What are we going to do? And we try to talk about it as when, not if, so that we're prepared. But it is very worrisome. I think, again, the message that I would like to get out, all of us in healthcare want to get out, is people need to take this seriously and understand that they are in control of the spread of this virus. So stay at home. If you don't have to get out, stay at home, wash your hands, and keep a distance.
I want to ask you a little bit more about PPE. I know you guys said that you are prepared. I know as a Huntsville hospital system, you guys are adequately equipped. However, you see the cases in New York, in hospitals where there's nurses wearing trash bags. I mean, that is so extreme.
Yeah.
But are you prepared for that extreme if it comes here?
That is one thing that we have tried to push as a very last resort. But that is another reason that we are working diligently to find every possible way that we can to preserve what we have. So we protect our supply ferociously.
The question that I asked Athens Limestone Hospital is, what worst case scenario are you prepared for? They told me their worst case scenario is 30 to 40% of their county getting. What is Morgan County's?
That's a hard question. If you'd asked me 2 weeks ago, today would be my worst case scenario. If worst comes to worst, our Huntsville hospital system is strong, and we've got some innovative folks that every single day somebody comes up with an idea. The other thing that has been impressing me is the different companies that have changed what they normally do, and they're putting out masks and they're sewing gowns. That's what we need. We have also started using some reusable gowns that you can wash. So the Huntsville Hospital bought those, and those were to go out to staff today. I'm not sure when our hospital will get those, but that's certainly an answer to some of the gown issues. So it's those kinds of things that we're doing.
When it comes back to being infected, do you have any possible number you could give us, a worst case scenario, Decatur, Morgan, anything like that, with a number you think could possibly get infected, worst case scenario?
Oh goodness! You could expect 50% even, but that would be my worst case scenario. I worry about our staff. They have got to protect themselves. We can't take care of the public if we don't protect ourselves.
That was my next question. How seriously are you taking, the staff being, they are on the front lines in front of that infection every day, and I've You know, I have friends that work in other hospitals in Alabama and hear different stories. You know, talk a little bit about, or maybe a message of reassurance to your staff and even people in the community that you are doing everything to protect those people on the front line.
So I told you that we have infection prevention protocols in place. Follow those to the T to protect yourself. You know, wear the proper mask when you're going to be in front of a patient that you know has the symptoms. We are trying to get to every patient before they walk into our hospital and to assess what their symptoms are. If they have respiratory symptoms, we put a mask on the patient. So those are the kinds of things that we're doing. And we are emphasizing to all of our staff constantly, we know they know it, but we're telling them again and again, make sure that you wash your hands. Wash your hands, wash your hands, and stay away from each other. You know, that's hard. I think particularly in the South, we're huggers, and we want to be close. So that's been a challenge. Just make sure that everybody stays apart.
And although that Hartsville Clinic has only been open for a few days, have you seen effects on the hospital? I know when we were at Athens Limestone, they have a clinic open and they've seen a tremendous drop in people, you know, coming into the ER, and their
Yes.
staff is, you know, not being overworked, not tired,
Right.
not working crazy hours. Are you seeing the same thing?
We are. Our emergency department numbers have dropped. We were having physicians calling constantly, what can I do? I've got these patients, I don't need them in the office, what can I do? We are doing telemedicine in physician offices, and so they're able now to have a resource of where do I send them for testing. And they've told us, we don't want to send them to the ER and possibly infect other people. We'd like to have a place where they can stay in their car and be tested. So it has helped.
Do you know how many hospital employees were tested for the coronavirus?
We've had 2,
2 tested.
yes, so far.
Confirmed within the hospital.
No confirmed.
Thank you so much.
You're welcome.
Michael Douglas, special ed is a little different of an animal as far as some are nonverbal. Can you expand a little more what you mentioned earlier on special education?
Basically, we're required to, you know, to service their IEP. We kind of have a 3-pronged plan. I will defer you to call Stephanie Underwood. She is finalizing that now. Please forgive me. The announcement came at 4. We got more information at 8:30. But going in, we've had other districts call us tell us about your special ed plan. Of course, the federal government has provided a lot of input that basically says, hey, you can do this. You know, but, you know, we're required by law to follow that IEP, and we'll follow it to the best of our ability. And it may get into some stuff that compensatory services later, but I will defer to Dr. Underwood. If you want to call her, she can give you more specifics.
Very good. Any other questions? Okay, well, thank you so much for joining us, and we'll see you Monday at 10. Thank you. Thank y'all. Thank you.